Thanks for joining Dr. Wood and I for a chat. We're talking about thrush, yeast infections. Women, men, who gets it? What is it? It's more symptomatic in women than men, probably like a ratio of like 100 to 1. Right. So a yeast infection. So basically all women's vaginas have bacteria in their vagina, and that's healthy. Right. And that bacteria, lactobacillus, is one of the main ones we like to be there. That makes the vagina a bit more acidic, so the pH is a bit lower, and that's healthy. Sometimes things happen in your life that makes your vagina less acidic. You might be on some antibiotics, or you might been too much swimming and in a chlorine pool, or you might be wearing too much nylon undies and that sort of stuff. So things like that can affect the pH of your vagina. Right. Or if you use too much soap in that part of your body, that can also affect the pH in your vagina, and that then when the pH comes a bit higher or closer to... What's the pH? The pH is acidity. Right. So acidity is a bit of a chemical, chemistry lesson here. The lower the pH number, the more acidic. The higher the pH number, the less acidic. So where do we want it? Around about 4. Okay. Okay. If you're not going to go get a litmus test and put a little bit in your vagina, but it has been done before. But we're not doing that today. But so acidic, so that's normal to be a little bit acidic. If it's not acidic, then yeast infections can come in, and the opportunistic sort of bug, they're everywhere. You don't have to go find it; it just happens, and that can then cause this to happen. Symptoms are sometimes you have a white discharge, sometimes very itchy, and can be red and swollen. Right. And so, if you ever doubt, go to your GP or your healthcare professional. They can take a swab. Okay. It's good to get a swab before you start treatment because at least you know exactly what it is. Okay. But once you've had it once or twice, then you usually know what it is and you can just treat it. Right. Now you can just buy over-the-counter preparations to treat it. Okay. So there's kind of medical treatment and there's like basic treatment you can do, right? So we're talking about medical things. You can buy various creams that are which are treatments for the yeast infection, and that goes right up inside your vagina. You use a little applicator. You get little waxy pessaries, which are like tablets which go in your vagina, and usually you use it for 6 nights, and it usually all goes away. Okay. There is a tablet you can take, which can also help treat it. And usually that's all required. If it continues to be a problem ongoing, you've got to look at things like your hygiene. Now, my strongest recommendation when people come to me when they're having recurrent yeast infections is to only wash with warm water. Don't use any soap, shampoo or anything strange down there. Try and wear mainly cotton undies, and try and, if you do a lot of swimming, to get out of your wet cozies as soon as you can. Generally, that's helpful. Thank you so much, Dr. Wood. Appreciate those tips. I'm sure that's helped you. Thanks for keeping it locked right here at Mums at the Table, and subscribe to our YouTube channel.